Hello and welcome to today's program of Medicare Supplemental Plans. My name is Tom McGinley and I'm a Medicare counselor with the Pennsylvania Medicare Education and Decision Insight Program, known as PA MEDI and formerly named PRICE. PA MEDI is the state health insurance program in Pennsylvania, funded by the federal government and administered by Senior Community Services in Delaware County. PA MEDI provides free, unbiased information on all aspects of Medicare. In addition to this program, other videos that are available include Medicare 101, Medicare cost sharing programs, and how to complete a drug and health plan comparison. If you wish to attend any of our presentations or schedule an individual counseling session, you can contact the Office of the Program Director, Glenda Radical, at 484-494-3769. And there's no cost associated with any of the services provided by PA MEDI. So with that, let's get started with today's presentation. And I think we'll be talking about our agenda. So today's agenda and objectives are how to understand the coverages provided by Medicare supplemental insurance and how it works with Medicare, recognize the different types of Medigap insurance, understand the differences between Medigap and Medicare Advantage plans, and understand what underwriting and pre-existing conditions mean and the impact on you, the consumer. So let's learn how the PA MEDI Medicare program can help. First, we'll talk about terminology that you'll see throughout the presentation. First one is copay, and a copay is a fixed amount for a covered service. Typically, it'll be something like $15 for an office visit. So that's a fixed amount that you pay each time you access a healthcare service. Co-insurance is a little bit different. It's your share of the cost, and it's calculated as a percentage, for example, 20%. So if you have an office visit which costs $100 and you've met your deductible, your co-insurance payment will be 20% or $20. Some additional terms are deductible. That's the amount you owe for covered services before your health plan begins to pay. In effect, it's like an entry fee into the program. So if your deductible is $1,000, your plan won't pay anything until after you've met your $1,000 deductible for covered healthcare services. The deductible doesn't apply to all services, however. Another term you'll see is excess charge. And that's an amount above and beyond what Medicare approves for a specific procedure. Excess charges, as it pertains to Medicare, are not permissible for services in Pennsylvania. So for most folks, this will be a moot point. Underwriting is a process used by insurance companies to assess your health status in order to determine whether to offer you coverage, at what price, and what exclusions or limits will apply. Next. Let's talk a little bit about Medicare supplemental insurance. It's also known as Medigap. Those terms mean exactly the same thing, and they are sold by private health insurance companies. The Medicare supplement works only for people who are in the original Medicare program, and there's 12 different types of Medigap plans, and they're identified by letter. The most popular ones are Plan G and Plan N. There are other offerings, however, but Plan G and Plan N appear to be the most popular. The plan benefits are standardized within each type of coverage. So a Plan G with Aetna is going to cover the same thing as a Plan G with United Healthcare. However, there could be differences in the pricing. So the plans are standardized, as I mentioned. They are a supplement to original Medicare. It'll cover most Medicare deductibles and the 20% Part B coinsurance. And you must have Medicare Part A and Medicare Part B to enroll. Next. Medicare supplemental insurance also is very good for people who are snowbirds because there is no network of doctors or hospitals to worry about. So when you travel, Medicare supplement travels with you. There's a monthly premium that's established for the coverage. And these programs do not include prescription drug plans. If you are in original Medicare, typically you'll have Part A, Part B, a supplement, and you would buy a standalone drug plan. We'll touch on that a little bit later. There's not an annual enrollment period for Medicare supplements. You can apply for a supplement at any time, but as we'll discuss shortly, if you're outside of the guaranteed issue period, you may have to undergo medical underwriting and could be denied. Next. So how do you enroll with Medicare supplements? Well, it's a direct contact with your insurance company. So you would contact the insurance company directly. And when you do that, they'll discuss whether you qualify for a guaranteed issue. And I think the next couple of slides will talk about this in detail. So the next slide, guaranteed issue. That is the 6-month period following enrollment in Part B, during which the insurance companies cannot deny coverage due to pre-existing condition. So it's important to note that this is a 6-month period following Part B, not the 6-month period following attainment of age 65 or anything else. It hinges on Part B enrollment. Next. If you fall within this guaranteed issue period, then the insurance company has to sell you a Medigap policy. You can't be refused. They have to cover all your pre-existing conditions, and they can't charge you more for a policy because of past or present health problems. So this is what's known as your guaranteed issue right and the guaranteed issue period. Next. If you apply for the Medigap insurance after the guaranteed issue program, there are certain issues that pop up. One is you may be asked to complete a health questionnaire or evaluation. Your monthly premium could be higher than similarly situated individuals. Your coverage could be delayed for up to 6 months, and your application can be flat out denied because of a health condition or health risk to the insurance company. So it's important to enroll during that 6-month period. Now, if you are continuing employment, this next slide is pretty pertinent to you because, again, another qualification is if you're going to sign up for Medigap and you want to have your pre-existing conditions covered, you need to have credible insurance coverage for at least 6 months immediately prior to a Medigap, before immediately applying for a Medigap policy. So the insurer can't make you wait before covering your pre-existing conditions if you've had that coverage for 6 months. Now, once your employer coverage ends, you must select a Medigap plan within 63 days to ensure coverage of pre-existing conditions. Next. There are a couple of recent changes to the supplemental plans. One is companies no longer can sell what's known as Plan C or Plan F to anyone who attained age 65 on or after January 1, 2020, or first became eligible for Medicare due to age, disability, or end-stage renal disease after January 1, 2020. Plan C and Plan F cover everything, including a Medicare Part B deductible. That's no longer a program that can be sold unless you turn 65 or met the other qualifications prior to January 1, 2020. Individuals who are currently enrolled in CRF don't have guaranteed issue rights. They are subject to medical underwriting if they want to transfer to another plan. So if you're in Plan C or Plan F and you want to change to a Plan G, you have to undergo medical underwriting. And finally, a new option was added to the list, and that is a high deductible Plan G. And that's a very low premium, but does require roughly a $2,300 deductible to be met before it covers. So those are some of the recent changes to supplemental plans. Next. So what do Medigap plans cover? Well, they cover the Part A deductible, which is roughly $1,500 for each inpatient hospitalization. The Medicare Part A deductible and hospital costs up to an additional year after Medicare benefits are used. There's a Part A hospice care coinsurance or copayment that's covered. Skilled nursing facility care coinsurance is covered. Medicare Part B at 20% coinsurance or copayment, that's covered. And it also covers things like the first 3 pints of blood and, in limited circumstances, foreign travel emergency care, although there are plan limits that apply there. Next. This is a chart that you'll see from time to time. It's in a book called Choosing Medicare Plan or Medigap Plan. We'll talk about that a little bit later, but this is a standard chart that's published by Medicare, and it shows all the different coverages and how each of the plans are covering each individual benefit. I won't go into a lot of detail here. I'll just say that most people going forward, as I mentioned before, tend to look at Plan G and Plan N as the two that are most cost effective. They're very similar. You'll see differences, essentially, that Plan N requires a $20 copay when you go to a doctor, whereas Plan G covers that amount. And the Plan G high deductible is also listed on this chart. So this is an up-to-date chart. Next. Medigap doesn't cover things like long-term care, dental or vision, eyeglasses, hearing aids, private duty nursing, private duty home health aides, and prescription drugs. Some of these entities are covered by Medicare Advantage if you elect to go that route, And we'll talk about that later on in the presentation. Next. So as far as the cost of Medigap plans, there's Medicare pricing that we're going to talk about. And there's 3 different types of pricing programs that insurance companies use. One is called issue age. And in this case, premiums are typically very low, and they won't change as you get older. They could change because of inflation or other factors, but not because of age. This is not offered by a whole lot of insurance companies in this area. The next one, Attained Age, is the one that's most prevalent. Under Attained Age, the policy premium changes as you get older. So as you attain a new age, that's what we're saying, as you get older, you can expect that the premium would go up. These are typically the least expensive at first, but eventually become more expensive. They could also go up because of inflation or other factors. And finally, community rating, which is not based on age. It's based on the claims experience of the group of people who are insured. So the rates can go up from year to year, but it will be because of inflation and other factors, not because of age. So companies have different premium costs, but the benefits are standardized. I think I mentioned earlier, the Plan G with Aetna covers the same as a Plan G with United Healthcare. So the coverages are the same, but there could be a significant difference in the premium. Now, next slide gives a little more detail on how Medigap plans are priced. This chart is available in the booklet Choosing a Medigap Plan, which will show you how to order later on. It provides a lot of details on the pricing options. But again, the 3 types of pricing are community rated, issue age rated, and attained age rated. Next. So here's how PA MEDI can help you out. We can help you find the right Medigap policy for you. We have access to a CSG actuarial website to provide plan comparisons. CSG specializes in individual life and health insurance markets, and their website is not available to the public and can be accessed only through PA MEDI. Next. The information provided on this website is general information, such as all the plans offered in this geographic area, the financial stability ratings of each company, the policy type, information specific to the company, and the length of time that they've been in the marketplace. Also, they talk about the premium. You'll be able to find information on the premiums, the actual monthly premium, what the policy fees are. Typically, there's a $20, $25 policy fee when you make an application. They'll talk about how the costs vary by age, and they'll give you a history of the average annual increases by the insurance company. Next. Other information through this website, it allows us to compare data on any of the available supplemental plans. So we can compare the price of a Plan G to a Plan N for any of the insurance companies. And we also can provide a comparison of up to 5 insurance carriers for the purpose of providing pricing information. So you'll be able to get a lot of information and make an informed decision on which program and which level of coverage is most cost effective for you. Next. Now, when we work with you and getting this information, we do ask that you sign a consent form that allows us to access information for you. This consent form is available either in writing, or if we're doing a telephone consultation, we'll just ask for a verbal consent, but you can expect to see a consent form being provided to you. Next. This is the booklet that I referenced earlier, Choosing a Medigap Policy. It provides a lot of detail on Medigap programs. It can be found on the Medicare.gov website under the Publications Blue Bar tab, and you can download it there. You can also contact the Delaware County PA MEDI office at 484-494-3769, and we can arrange to have a copy of the booklet mailed to you. Again, this provides a lot of details on Medigap policies, all the ins and outs, very worthwhile to get. Next. Now, when you sign up for Medicare Supplements, that's another card that you'll have to carry around with you, or at least have access to. You see the different cards that you will have as part of the original Medicare lineup. You would have the red, white, and blue card for Part A and Part B. You would also have a PDP card, prescription drug plan card, assuming that you sign up for a prescription drug plan, which you should, and that's a standalone plan, and you get a card for that. And then finally, you'll get a Medicare Supplement ID card, What's shown there is a card associated with the Aetna program. It'll have your name, policy number, and the level of coverage, in this instance, a Medicare Plan G. So you'll have 3 cards. So again, the original Medicare lineup is you have Part A, Part B, a supplement, and in all likelihood, a prescription drug plan. Next. So next we're going to talk about the competitor to Medicare supplements. And I want to stress that Medicare Advantage plans are not Medicare supplements. They are another way to receive Medicare benefits, and they're sold by private insurance companies. Now, Medicare provides a subsidy to insurance carriers to help defer some of the cost. So when you see a 0 premium plan being offered, it doesn't mean that there's no cost being submitted to the insurance carrier. Medicare is providing a subsidy to help with the Medicare Advantage programs. When you join a Medicare plan, you choose a managed care structure. Typically, it's either an HMO or a PPO. So an HMO is a plan where you must stay within the network. An example of that would be the Keystone 65 plans. A PPO is a plan which allows you to go out of the network, but for an additional cost. So an example of that would be the Independence Blue Cross Personal Choice Plan. So you make a decision as to whether you want an HMO or a PPO concept, but either way, there's a network to consider when you join those. So with the Medicare Advantage plans, you will have a monthly premium. You typically have to satisfy deductibles for different services, and you have copays. So you might have a low premium, but you're going to have higher out-of-pocket costs with the Medicare insurance program. Most of these plans offer prescription drug plans as part of the overall program. Just make sure to ask to make sure that that's part of the coverage. Typically it is. And if you have Medigap plan, you can't have Medicare Advantage and vice versa. So these are competitive plans to the original Medicare option. Next. So let's go through a more detailed list here. Overview of the Medigap versus Medicare. On the left side, we're talking about the original Medicare lineup, which includes the Medigap supplemental plans. And with those programs, you can use virtually any hospital or doctor that accepts Medicare. It's readily accepted by doctors throughout the country. It covers most deductibles, copays, and coinsurance. You don't have to worry about referrals. The coverages are standardized by plan letter. If you want a drug plan, you have to purchase one separately. And you can switch those drug plans annually, so it's not a lifetime commitment or subject to pre-existing conditions. Medigap does not cover some of the extra benefits that you'll see in Medicare Advantage, such as vision, dental, and hearing. And you may be subject to underwriting if you switch plans under a Medigap plan. So if you're with Aetna and you want to switch to Transamerica, you may have to undergo a medical evaluation, and may cost you more. You may be denied. You can be rejected for pre-existing medical conditions if you don't satisfy the open enrollment, the Medicare open enrollment period for the Medigap plans. That's 6 months following Part B, and premiums can be increased from time to time due to other health conditions. The Medicare Advantage plans, they typically are local plans with assigned network doctors in this geographic area. Not all doctors accept all Medicare Advantage plans. They usually include drug plans. They have copays and deductibles. You might need a referral. The benefits vary from company to company. So an Aetna plan might be significantly different from a Blue Cross plan. You can switch plans yearly at open enrollment, and you can receive extra benefits sometimes at extra cost. And there is a maximum on your out-of-pocket cost under these plans. So typically somewhere around $7,500 is the most you would have to pay out of pocket for Medicare Advantage expenses. That doesn't include prescription drugs, just the medical component of it. Next. So if you need help in making a decision on which plan is best for you, best thing to do is to set up an individual appointment with PA MEDI. The number is 484-494-3769. You see the email address there as well. And we have a website, delcomedicareprogram.org, that provides a lot of additional information. So we're here to help you out. Next. Okay, so any questions, you can refer those to the PA MEDI office that we referenced earlier. I think we have one more slide after this. And that's just a disclaimer letting you know that this is not intended to be a full explanation of Medicare supplements. And if there's any discrepancy between what we said and the actual Medicare regulations or the insurance company contracts, Medicare regulations and the company documents will govern. So that's it. I hope you were able to get information here that you can use. Feel free to contact us for additional supplemental information. And thank you for your attention.